Welcome, everyone. This is Susan Clinton, one of the co-hosts of the Genius Project with Carolyn Van Dicken and Joletta Belton, my co-hosts. And tonight we are doing part C of Project 4, which is Compassion and Pain Care. And our expert on our panel is Shelly Prosko. We're so happy to have her back, and we're opening it up for everybody's questions. And we're just going to explore the topic just a little bit further. So without further ado, Shelly, one I would like for you, before we even get started, so we don't have to wait till the last minute to do it, tell us about some of the projects you're involved in and your fabulous yoga and pain science book that's come out.
Oh, okay.
Let's do a little promo
projects.
first.
Let's see, projects. Well, right now I am working on another online course on this topic, compassion in pain care. And so I want to, bring not just the theory part, like I think many people have seen, because I have some free webinars and, at the San Diego Pain Summit, that's been out there. So I want to take that, that 1 hour kind of lecture and then turn it into an online course, which will be similar to the 2 and 3 day course that I do on this topic. But it'll be an interesting blend, because the course that I teach is more of a retreat style for healthcare providers. That's like for self-care and addressing burnout and empathic distress through yoga. But this online course, I'm going to make it for everybody. So that includes all healthcare providers, people in pain, and really just anybody that I think that could benefit from learning more about compassion, in life in general and in healthcare. So I'm working on that. And then another.
Where will the online course be housed?
I'm gonna do it through Embodia again.
Okay.
Where I have my other Embodia.
Yeah, great. We'll put the links into the show notes.
Okay.
So, perfect. Yes.
Yeah. We have. We all have. I think all of us here almost has courses on there. It's a great platform. Yeah. And then I'm writing a couple other book chapters. I'm right in the midst of that. So I'm doing a lot of writing, and the topics, one topic is about, I don't have the title yet, but it's really about the subjective interview, but I like to call it the narrative review is what that I kind of came up with. So just, that all the different, not criteria, maybe criteria, basically what we need, right, to be able to really create a good space for this narrative review and co-create the narrative with the patient. So, and then another book chapter on yoga and pain. And then what do I have? Just courses and different things for 2020. But the book,
Yay!
I never leave home without it. So the book, what did you want me to say about it?
Anything. There's a wonderful chapter on compassion and pain care in this book. And right. Joletta has a beautiful opening in this book too. Absolutely.
Oh, this might be a good time to let Joletta know then. So Joletta, so Marlisa and Neil and I, we have a lot of different things planned for 2020 on different courses and webinars like around the book. And because there's so many different chapters and there's so many different contributors, we're trying to find a way that we can include the contributors. So we haven't told you all yet, but we are we're in the works of, how can we create something, whether it's every other year, something that's on site, and then every other year in between that, something that's online. So that's something in the works so that we can, all really share our work and our messages in here. And then, let's see, I think that's, just the book is out, and I think the whole premise of, there's a whole bunch of different reasons why we wanted to do it, but the premise is really to help yoga professionals learn more about the science around pain and how yoga can be used to help people in pain. That's in line with the science and or contemporary views around pain and the lived experience of pain, and then also to help healthcare professionals learn more about how they can integrate yoga teachings, principles, practices, and also the same thing to help increase pain literacy, really, which includes, of course, the lived experience of pain. So we just want to bring, all that together, and we wanted a lot of different perspectives. So we didn't just want a few people contributing because, of course, pain is so complex, and we thought that it would be best if we had a lot of different perspectives in there. So we're really proud of, all the different people involved. And although I write a couple chapters, it really has been such a collaborative effort. And and that's why we're here today to talk about the compassion piece, which, I had such a blast writing and researching for that whole chapter. Although I should be clear, a blast to me is like going to a party and having a lot of fun. So no, I guess it wasn't necessarily a blast. It was challenging and hard, but I learned so much, and I grew so much. And I am still, I know you say the word expert, and I suspect, we all have different meanings of that word, but I really don't feel like an expert in this area. Like I know that I have experience. I know I have, knowledge, but gosh, to be an expert in the area of what we're talking about here, I don't feel totally comfortable with that, to be honest. But I know you know what I mean. I mean, I appreciate the fact that I do have this knowledge and experience that I am sharing, and I'm going to continue to share, and I think I have a lot to offer, which is why we're here, and I can't wait to answer your questions. And I also think all 6 of us here that are on now, hi Robin.
Hi Robin, thanks for joining.
Yeah, I think, all 6 of us, whatever the questions are, I know we have, different perspectives and have things to offer. So I really want to make that clear. And I've learned from all 3 of you that I know here, Joletta, Carolyn, and Susan. I've learned from you. And if I spent time with Nicola and Robin, I would also learn from you. So
I really like the term expertise instead of expert, right? You have some expertise in an area.
Absolutely.
There's not a kind of a limit to that piece. I think it leaves lots of room for growth. But, our culture is very much one of sort of, here's the expert. And so we use that terminology. But yeah, I know Susan.
Yeah, and I get it. It's fine. And I'm fine, but I just like to kind of
clarify that.
Yeah.
So thank you, Robin and Nicola, for joining. And so maybe we'll start with either of you. Do either of you have a question for Shelly? And maybe after you've had a chance to either hear her speak or read some of her work or learn anything on your own about self-compassion?
Yeah. So one of the things that's kind of came up quite a lot for me is I've kind of started to dive in. It's kind of a fairly new thing for me is self-compassion, both for me as a healthcare profession. When you talked a lot about perfectionism last time, yeah, I think that's an epidemic in healthcare providers. We have to know it all, like the strive to be the expert, that word. And when people put that word on you, you try and get it. But the other thing that I've kind of been reading about is the kind of non-judgment towards other people's experiences. So I wanted to kind of get Shelley's take on how to maintain that non-judgment, because that's something I think myself as a healthcare provider is very hard when you're trying to maintain that empathy, that level of empathy with the patient who comes back for the 10th time, 12th time, and still is not following through with what we've discussed or the plan, and you're kind of trying to maintain that compassion and not be judgmental of the decisions they're making. And I know that's a big part of being compassionate, and the kind of understanding for them to understand compassion, you have to be compassionate. So yeah, I hope that made sense.
Yeah. Yeah, I love that question, and that's one I reflect on probably almost every day for myself. And one of the things that I always say is, like, it's easy when it's easy. And we can all sit here and talk about this, and you can read a chapter. I can sit and, preach about it. And when it's easy or when it's just moderately challenging, we can do it. And then when it gets challenging, it's challenging. It's easy when it's easy, and it's really hard when it's really hard. So some of the things that I've done that seems to help me, I can speak to that. Number one is just my own personal practice, which means just that constant state of coming back and being aware as to what's happening in my body. So when, let's say, a judgment does come up, whether it's a thought or it could be maybe a feeling in your body. So if you can even think about a situation recently that you had, if you want to choose one that's in the, in your professional practice with a patient, you can even just think back to the scenario. And so whether it's a specific thought that you have, that practice, that daily practice that you have of being mindful and being aware does change your brain, and it does help you just catch yourself. So when you have that thought, you'll be better at even knowing that you have the thought. Because believe it or not, often we don't even realize it. Things just kind of go under the radar. So the more we practice that 5 minutes of awareness practice or mindfulness or whatever it looks like to you, it could be a body scan, a breath scan, it could be just a meditation, and we can talk about some different things if you don't have your own practice. But the more you practice that, then when you're in that situation, number one, you'll notice the thought, you'll see the story, it'll be very clear, and then you catch it. And then if you've practiced the self-compassion piece, you'll be better at saying, like, that's okay. Like, it's actually okay that you might have a judgmental thought. And, I will even say, even if it's quite harsh and you're not proud of it, it's that idea that, like, that's just the human brain, responding. And you can cultivate them that go through those three components of self-compassion. So you're mindful, you're aware, you're not alone. Like many other people would think the same thing, would make the same judgment, and then offer yourself some kindness. And then you just come back to the moment and create space and listen. And so for me, my own practice has helped. So again, obviously, I'm a work in progress. And there are times when I don't do well and maybe I don't catch myself. But I'm better. And I've measurably, well, I guess I haven't really measured it. That's probably not the right word to use. But I've just seen a significant change in myself since this, in that I just catch those judgments and then they just kind of like they float away, and I'm not attached to them. And then it just creates a kinder space. So that's one thing, is just being aware, do your own practice. And then another thing that comes to mind, and then I'll see if the rest of you have anything to add. One thing that's helped me, have you heard of the 4 agreements?
It's on my shelf. Yeah.
I've not heard of it.
These have helped me. So this is even before, I ran into the self-compassion stuff as a real thing, as a construct. This was already helping me, just gain deeper insight into people's struggle. So the 4 agreements is, so number 1, don't make assumptions. Number 2, don't take things personally. Number 3, always be impeccable to your word. Number 4, always do your best. But out of those, not making assumptions and not taking it personally are really big for what we're talking about here. I mean, all 4 are, always do your best and be impeccable to your word. But what I find when I get into situations where I'm feeling the negative bias towards the person or the story. If I can come back to, I'm making some assumptions here, don't make assumptions, but also, don't take this personally. Even when I've had situations where people have even said things to me that's I could chalk up to quite personal. It seems quite personal, but we don't know the whole story around it. Each and every one of us and our brains, there's all kinds of things that we say and don't say. So not taking things personally, I think, has been really, really helpful for me. You know. So I don't know if that's hopeful, and something else, as I reflect, might pop up. But do you have any other questions to that, or did that make sense to you, like your own personal practice? And
yeah, that made sense. Yeah, I think that, like, it's funny because I actually have that book on my shelf. But yeah, no, I think it's hard not to be harsh on yourself as well, as I think it's, yeah, like I said, self-compassion is kind of something that's new to me. Kind of, I blame Carolyn for it all, but
Broad shoulders.
but kind of trying to, I think it's trying to step back from a lot of things, and not take things personally. I think sometimes we, as healthcare practitioners, are very guilty of taking our patients' failures home with us, and taking it kind of a little, and I think sometimes that reflects on the way you then treat that patient from that point on. So you're then stepping away from that self-compassion model, and really just, I think that's something, I know it's something. Even within the clinic I work in, the other physiotherapist I work with, we're trying to work through that with him a little bit as well. I see the frustration when patients aren't following through as well, and trying to deconstruct that a little bit within the workplace.
Yeah, and just remember too that there is some research that's showing the more self-compassion we have and the more we cultivate that, the more increased concern for others that's been shown. And again, this might be repeating a little bit, but I'm just going to say it another way. We can even be hard on ourselves for being judgmental towards others, right? It's like, okay, we're not being, kind enough, we're not being compassionate enough, and then we're not being self-compassionate enough. Like, it's that perfectionism again coming in. So for me, and I'm still working on it, but I do see this melting away and dissipating of the judgments towards others, towards myself. Once I just am okay with the fact that I have the judgment, like truly okay, and I feel it. And that's that self-compassion work, I think, that over the last few years has really helped me, because now it's not just like this intentional practice, but now it's happening more automatic. So again, I see the judgment that I have, the ill feelings maybe that I have towards the person, and now I can not only be aware but say that's okay. Like, I'm not a bad person, and I don't think that this person is that or that. These are just some normal thoughts that everybody has, and then it just, like, once I accept it, almost like you cradle it and like, okay, and then it just kind of dissipates, So, I mean, that's not it's not like that all the time, but I have seen a change.
No, that's great. No, that made perfect sense. Thank you.
Robin,
Yeah,
do you have
and
any other questions?
good luck.
Yeah, that's awesome. Great question, Nicola. Robin, do you have any questions for Shelly?
No, thanks for having me. I'm sorry I was a little late.
That's okay. Thanks for
my restorative yoga practice with my client ran a bit over, and we've had quite a bit of snow in southern Ontario today. So yeah, I guess my major question is, To add to Nicola's piece, I found a really big shift for me after taking level 3 with Carolyn was kind of the shift that I'm a guide for my clients, rather than it's not my job to fix them, right? I've got lots of tools in my toolbox, but when I'm sitting with a client that's stuck, I've really seen a profound shift and a really exciting shift if I sit with them and I'm curious and compassionate towards them being stuck, and purely compassionate towards them from a higher, almost a mindfulness state. They'll show the direction forward every single time. And it might be very, very small. Like, I'm just going to reduce sugar this week. And something that as a physio was not even on my radar before, right? But it's about empowering the patient, I see, if we're practicing from a place of compassion. Because I think when we have an agenda to fix our clients and we go in with that agenda, we're not empowering them at all, right? Where I'm going to come in here and I'm going to fix you and I'm going to tell you what's wrong with you. A big shift for me has been saying, no, you live with you and you know the answer if we sit and listen to that. Do I get it right every single time? Absolutely not. Does my thinking brain take over and go traditional ortho? Yeah, right? Especially with those people that are a little bit threatened by the silence, by the curiosity that I bring to the room. Especially, I'm in a hard ortho clinic practicing extreme compassion, which has been interesting as well. I guess my question for Shelly and the more advanced practitioners is, for me, it's more about, I know this way of practice resonates so strongly with me, but I flirt, and I think Carolyn will remember me saying this when I took level 3 potentially, as I flirt with scope of practice. And my concern, at least for me, is, and I'm always relating it to their body and their goals, but I find myself treading this very interesting, exciting line of, let's tap into your emotions. Let's tap into your emotions in your body. Let's talk about your nutrition. And that's where I get stuck a little bit. My thinking brain gets stuck of, this is curious, this is good stuff, this is wellness. But from a pure hard physio scope, I struggle. I don't know if that was a question.
No, like I get what you're saying. I'm just trying to clarify the question for me. Mm-hmm. So, if we can hone it down, so like, as you said, like about emotions and about nutrition. And so if we're talking in the context of this stuff, like providing compassionate care, self-compassion, maybe helping people, improve their own self-compassion. Like, are you thinking that this topic as well, what we're talking about, you get a little bit confused on how to stay within scope, or
no, I think being a holistic physiotherapist and moving people towards wellness in their body, compassion has to be a keystone there. But I find as I practice with compassion, the conversations that it opens with my clients, and for my clients that are really stuck, those clients that are having issues with maybe reaching out to a nutritionist or socioeconomic factors, in terms of, I don't know, with the more advanced practitioners, do you kind of put a box around, my scope is movement? But I'm not sure if you guys see that it can really blend into a lot of areas of wellness, especially when that person is stuck. And if I say, oh, go see a psychologist, or you need to see a psychologist, you need to see a nutritionist, there's so many barriers there for those clients. So navigating that is difficult for me from a compassionate standpoint.
So, okay. So when you talk about offering compassion and you, I think if I heard this correctly, so you had said sometimes when you're offering compassionate responses or compassionate care, that can take you into conversations that you feel might be out of scope. Did I get that
Yeah.
right? Is that
Absolutely, 100%.
so if I may ask you, so could you give me an example of what that means to you, like when you're providing compassionate care?
Yeah, I'll use actually my
That's kind
client.
of a big question, but okay.
Yeah, I'll use my client tonight, for example. So we did a restorative yoga practice, and this woman has suffered multiple losses of child from stillbirth and miscarriages. And she's been to practitioner after practitioner after practitioner with systemic pain, pelvic pain, jaw pain, and one of my colleagues referred her to me. And she's made consistent changes, but as we work with her body and as we approach her body with compassion and I guide her through her practice, she'll say, I'm holding anxiety, and I'm pretty sure it's from when I was a kid. And then after leaving those sessions, I'm compassionate with myself and saying that was well-rounded care. But I guess for me, from a physio perspective, with scope of practice, there's a little part of me that says, am I treading in an area that I shouldn't be?
So I'll just speak to the compassionate care part. So if you think back to like the 6 elements of Halifax's model, I'm not sure if you're familiar with those, but so, providing compassionate care can look many different ways, shapes, and forms, and you can provide compassionate care in a traditional ortho type, setting in 10 minutes. If you're mobilizing somebody's ankle, compassion can emerge from that. So I think just what I would say in response to just the compassionate care piece is that if you think of, just those 6 elements, like the first is just being totally present and attentive, right? And we can do that within scope. That makes sense. And then the second is that affective. So that means paying attention to your own emotions and even cultivating, with practice, cultivating positive emotions within yourself. That's a separate practice. But that second domain is just being aware of your own self and emotions so that then you can better regulate your own emotions. And that might help you deeper insight into the person's struggle. So again, that would be within scope of any healthcare provider and us therapists. And then that leads us into intention and insight. So this is just having an intention, which could be anything you wanted, but often I like to say, how can I take care of myself first, right? Set the boundaries, care for myself first. How can I care for others or care for the person in front of me? And how can I serve? So again, you're doing that, and you could say, how can I serve within my scope? So that's part of the compassionate care. And then the insight is, again, it's gaining with all of that together. That's gaining deeper insight into the person's struggle. So in this example, she's maybe expressing to you some of the reasons why she thinks she's holding this anxiety. And, your job there is to, listen and create space and to hear that. And you don't have to try to necessarily fix it. And we're not psychologists to try to fix it, but you can hear that. And that might help you gain deeper insight into why she's holding her breath or why she's gripping. And then you can use your physio, scope or your skills to work through breath to help release movement without being a psychologist. So it's like gaining that deeper insight is all that we're doing here. And however you want to respond. So the last 2 parts of that compassionate process is the embodiment, which again is that's you and your practice of keeping yourself fully within your felt sense and see what's going on. So as she's telling this story, and maybe you're feeling some tension, maybe in your throat, your body, and maybe part of your tension is that you're, like you said, you're still confused as what's in scope or what's not. Maybe that's somehow creating some tension within you and interfering maybe even with your thinking. So your job in the embodiment piece is doing your best to divide your attention between what's going on in your body and paying full attention to the person in front of you. And then the last is is the engagement piece. So for compassionate wisdom to emerge from that situation that you just said, all of those components I talked about, then finally, what would be your compassionate response? And that could be all kinds of things, right? It could be, like I said, creating space. It could be maybe she just needs to, to share that with you, and for you to say, thank you for telling me that, and really, just to be heard and listen to you. And then again, you can work within your scope. Response might be maybe asking her, what can we do, a certain movement or a certain position, or try this breath practice. Does that help? And just, instead of going into a talk therapy session at that moment, you could keep her, still within her, connected to her body, her emotions, thoughts. We're not trying to distract the person. We're trying to help them keep present. But that's kind of my answer to just what we're talking about here, which is the, compassion staying within scope. So I would say absolutely we can stay in scope with that. As to some of the other things like nutrition and having people, as they share the stories with us, and maybe getting into some stories that we may feel uncomfortable with because we're not trained or skilled to work with that. Just remember that that's not what the person is asking, right? They're not asking us to cure their anxiety or their depression. And if there is a very straight out request for that, then of course we could ask them, about other options or referring out. But maybe look at yourself and ask yourself, and you don't have to answer it now, Robin, but ask yourself, when you have these feelings come up, like you're conflicted, maybe just ask yourself, is it me that's trying to fix the anxiety, with her? Is it me that's trying to fix these things? You might be what's the word I'm looking for? Your frame of mind maybe might be such that you're thinking you want to fix some of the mental health kind of things that maybe are going on, when in fact you're there just to provide the space and listen, and then work within, like I said, what is all within your scope. So that's what I would offer. Does anyone else have anything to offer to that?
So as I was listening to that, Robin, and we have had this discussion a number of times, I guess, Shelly, you had such a beautiful way of just sort of creating this framework, really. And so compassion, as Shelly describes it, really is a framework. Sometimes I think it can be a tool that we can use, but the way Shelly's really talking about it really is a framework at this point, right? And I think that's often, Shelly and I have had this discussion about using yoga as a framework or yoga as a tool. Those are kind of two different things. And so I think if we can use the framework of compassion, then I think that almost helps us to stay in scope, because compassion really is about helping, just being curious and helping them to be kind of curious around what that connection is between sort of their breath or being still and their anxiety, right? And then getting them to be curious, because I think the other thing that we forget is that there's some really good evidence in the expressive writing literature that we are actually our own best therapists, right? Mm-hmm. That, like physical pathology that we love to label as physiotherapists, we are not fragile. We are not we shouldn't over pathologize, right? Especially in persistent pain. And that in emotional distress as well, we shouldn't over pathologize. So we don't have to pathologize anxiety as much as acknowledge it as an emotional state, right? And then give them, sort of have them be curious as to kind of what they think they need to do about that. And one of the tools I've been using more and more in my practice, and I don't know if anybody else has been sort of working with that a little bit, but again, following through with that concept that people are their own best therapists, is to use this expressive writing assignment where they just write about their anxiety, maybe for 20 minutes, 4 nights in a row, or once a week, 4 weeks in a row. It's a very defined, limited type of journaling. And again, if we use the objective measures to say what was their anxiety level coming in, and maybe after doing this exercise, what is it? You can also be very objective and relate it to pain and tension. It's in our scope, right? If you relate it back to pain and tension and what we're treating, and again, you're empowering them to move in a way emotionally, right? As we empower them to move physically as well. It's their job, not ours.
I love that. And that's just, the question was beautiful. The answer was amazing. The insights are so important. If you're interested in Halifax's work, this fourth project here, this is number C, Project 4C. Project 4A, if you go to our YouTube channel, you can hear about Halifax. And then Project B, Shelly actually discusses those domains there, which is helpful to hear because it's about training compassion and working on that piece that sometimes I think we all struggle with so much, but we also are really good at too. And we don't give ourselves enough credit for really having that inner wisdom, much like we want to give our patients credit for having their true inner wisdom about what it is that they really need to do, and helping them be build self-efficacy with them so that they can feel empowered to say, you know what, I know what I need to do, and I'm to really help build that up. And we need to build that up in ourselves too. I learned this from Shelly, is if compassion fuels healing, then maybe self-compassion is the precursor to healing in many ways, that, so we can feel more empowered into what we do. But I think we do struggle with scope a little bit and those things. And I think one of the final things that Halifax said that I loved, that I learned from Shelly, was a ritualistic ending and beginning to every session. I think a lot of burnout happens, or from what I could gather from all the readings I've done, is because we take on a patient and we never have a closing at the end of the session. We bring actually all of our feelings and theirs with us into the next one. And by the end of the day, we are spent. And sometimes having that nice, I think Halifax said, even something as simple as while you're washing your hands, being able to say, this is, like a brief summary, and whatever dialogue you need to have with yourself to have this lovely closure, and then breath before you go into the next one. And something sometimes so simple has been amazing for me, for sure. But everybody's got, everyone can discover their ritual of how they're going to do it. Self-reflection, whatever it needs to be for everyone, at the end of the day. So.
And I think, that's so powerful. Yeah. Go ahead, Shelly.
Yeah, just echo that. It's rituals and ending and closing are, I'm getting some feedback here. I don't know if it's me or, are you guys hearing that, or is that just me?
I am. I'm going to mute Manata. I think she okay, we should be good.
You got it.
Okay.
Yeah.
Okay. So the ritual and the closing, anyone, listening to, is this replay? Will people be listening to this on a replay as well?
Yes. Yep.
Yeah. So anyone that's listening to this, I recommend exactly what Susan just said. Just try it. It doesn't have to be anything fancy and profound, but that just little ritual of ending. And another tip I want to give you all, and I think I maybe touched on this, but in case I didn't in the last one, I want to say it again. This is for ourselves, like in our professional practice, but also just every human being, for all of us. Try try setting, like in blocks, block intention setting, if you're willing to. So especially coming up in the holiday season, and we're going to be, going to all these different houses and different families and friends, and what you can do is intention blocking. So you take chunks of your day. So you're lying in bed. What's your intention, for this first part of the morning as you're getting ready for your day? And it's just can be simple. I want to stay present, or maybe it's just I'm going to focus on my breath, or maybe your intention is I just want to be kind to myself, whatever. And then you go out the door. What's my intention now, for my whole morning, wherever you're going to go do some errands? My intention is to, it could be just, have fun and really stay present, or some, or connect maybe with people that I'm going to be running into. And you just block that. And then the afternoon, and then you can do that, in the evening, or if you're going, like I said, to some social event or something over the holidays, for those 3 or 4 hours you're going to be there, set an intention, one thing that you'd like to focus on. And it can be really, really powerful. And then you can actually do that with each patient as well, if you want to bring it into the work setting. So, yeah.
Well, thank you, Shelly. We're going to wrap this up. We've been about 45 minutes. And so just want to take a moment again to thank Shelly so much from the bottom of all of our hearts for spending the last couple of hours with us in the second session and this session. Thank you to Manata and Nicola and Robin for coming on and asking some great, insightful questions. And we will see you again in the new year for the start of our next project, which is a surprise to us all at this point. So
Yes.
stay tuned. And yes,
I have a
Shelly.
question.
Yes.
Yeah.
You're about to close, but I was wondering if Monat had a question. Like,
Yeah, Manat, are you there? Can you turn your video on, or I'm going to unmute
because
you?
I don't know if we're running out of time. I didn't mean to. We can close, but
We're
I just thought since she came on, if she had a question.
Sorry, can you hear me?
We can, Manat. Yeah.
Okay.
Yeah.
Hi. Sorry.
Welcome.
I joined that. I must have just pushed the button to come on, but I didn't have a specific question.
Okay.
Yeah. I
Okay.
came on later. Sorry.
No trouble.
That's great.
Well, thank you for joining, and hope you enjoyed what you heard.
Thank you.
And,
Thank you. And so if we do have time, do we have time? If we don't, just tell me no.
No, go for it.
I wanted to know, Joletta said she had some questions. Do you have a question, Joletta, or not really?
No, I had some backup things, but I think that the questions that were asked were wonderful. And I did want to just mention on the scope of practice stuff that it's within everyone's scope to hear someone's story. And it's what you do with that happens within that scope. But hearing people's stories is within everyone's scope. And when people worry about that, I always like to draw the parallel to bartenders hear people's stories all of the time, and it's totally within their scope of practice to hear those stories and to provide that listening ear and making someone feel heard and seen. And that's what so many people are seeking, because they feel invisible and unheard and invalidated so often in their care. But so I just wanted to add that. But no, Shelly, I think that your answers to the questions that were asked were beautiful and covered a lot of ground.
Super. Well,
Thanks everyone.
Thank you, everyone. We will sign off and say goodbye. And until the new year, have a fabulous end to 2019, and we'll see you in 2020.
Thank you.
That's crazy.
Right.
Bye, everyone.